And good afternoon. It is Friday, and it has been a minute since I talked to you. I had planned to do this report a couple of weeks ago, and I woke up with no voice, and I had to speak at a conference the very next Saturday, and so I didn't do the Facebook Live because I would have been very raspy, and I needed to save my voice because I was speaking at a convention the next day. So everything went well, and then we were on vacation, and now I'm back, and here we are, and we're going to be talking about antibiotic-resistant bacteria and antibiotic use, okay? So this is something that just to set the record straight, so if anybody thinks that I'm against medicine, I am not against medicine, okay? I'm so thankful that we have doctors. I'm so thankful that we have the drugs that we have, because when we need it, right? What I'm not so happy about is that there can be overuse of antibiotics, and when that happens, we create superbugs. So how do we create superbugs? Well, all of our meat and all of our dairy and our poultry, okay, those three things are full of antibiotics, right? They're full of hormones and antibiotics. Why is that? Well, the farmers, the industrial farmers, they put antibiotics in the feed because they want their animals to be healthy, and they don't want them, they're in very close quarters. They don't have a lot of air. The communicable diseases, just like humans have, the animals can have, and so they regularly put antibiotics in their feed to keep them healthy, because every animal is got a price tag on it, right? And so they want to take everyone to market, so there are antibiotics in there. There are also hormones in there. Why is that? There's hormones in there because they want their animals to get mature much faster. And so they add antibiotics and hormones to protect their herd and to grow their herd more healthy. So, or larger, faster, not necessarily more healthy. It's certainly not more healthy for us, because when we ingest that meat, that poultry, that dairy that has antibiotics in it, then our system has a lot of bacteria in there. I can't remember the exact number, but we have more bacteria in our bodies than we actually have cells. We have about 70 trillion cells in our body. And so the the bacteria that we have in our body is even more than that. When we are born vaginally, which is the way we should be born, then as the baby comes through the birth canal, then the baby is inoculated with the mom's probiotics. When the baby breastfeeds, also the baby gets probiotics. Don't ask me how all that works. I don't really know. I don't really care. That's just the way it is. More and more people, for convenience sake, are having C-sections. Now, we're not talking about the people that are in life-threatening situations, that's what they have to have because they need to live through it. The baby needs to live through it. Thank God we've got that for those situations. However, when we choose to have a C-section for convenience, I want to do it on this day. I want to do it with my doctor. I don't want to, my doctor's going on vacation. I want to do it before he goes. When we do it for convenience sake, what we're doing is we're robbing the baby, because as the baby goes through the birth canal, the pressure of birth gets all of the yuck out of the baby's lungs. So the baby's going to be more healthy with the respiratory system. Whereas if you have a C-section, not so much. When you have a C-section, the baby does not get the good antibiotics. And so when we are born, we're born vaginally, then we get those good antibiotics. So it sets up our immune system to be able to do what it needs to do. Now, babies, little children, toddlers, they play in the dirt, right? That's what they do. I play in the dirt. I like to garden. I like to play with my plants. I feel very good when I do that. It's very relaxing. It's very refreshing for me to do that. Some people find it work. I don't find it work. So when I'm in the dirt, when the children are in the dirt, they're going to breathe the dirt. They're going to, get it in their mouth. They're going to, whatever they're going to get. That sets up healthy microbe balance in the body. Now, I'm not saying go out and eat dirt. I'm not saying that, because we don't want you to do that. However, when you're in the dirt, the kids are in the dirt, they're picking up things, their bodies respond against that, and it trains their immune system. What is self? What is not self? That's what we need. When the body knows this is self, this is not self, then your immune system works the way your immune system wants to work, and that's what we want. When there is a breakdown, all right, we don't have the right microbiome to counteract a bacteria, to counteract a pathogen, whatever it is, then we get sick, we have to go to the doctor, and the doctor is most likely going to prescribe antibiotics. So that's kind of how the cycle works. Now, what we're going to talk about today is some facts that I did not know. I try not to take antibiotics when I wake up and I feel bad. I've told you guys this before. I have natural things. I do natural silver. I do, here's a liquid silver. It is, I think it's 20 parts per million, which is a really good dose, right? It is a natural antibiotic, a natural antiviral. And so when I wake up and I don't feel well, I'll do that. When I'm traveling, I'll do that. Wild oregano oil, not the essential oil, but it comes in a little gel cap. I'll do that. I'll do an herbal formula called IVH, which stands for infection and virus, right? So I'll do those kind of things. Why do I do that? Because these things are natural. The way they are grown, the temperature, the ground is good. There's no pesticides in the ground, that kind of thing. So as they grow, they know, just because it's the innate wisdom of the universe, right? They know what virulent things are out in the atmosphere. And so they grow that protective ability. And so when you take them in, they are brand new products that the bugs have never seen before. So these products are very efficacious in stopping a cold, a virus, anything like that. If you don't have access to that, or you don't believe in that, or you don't know about that, then you're going to go to the doctor. The doctor's going to give you antibiotics. And what the antibiotics do is it squashes all of your bacteria in your gut. So when we are born vaginally, we have 80% good bacteria, 20% bad bacteria. When we take a course of antibiotics, all the bacteria goes down, the good and the bad. So we're thankful because we get over the infection, because the bad bacteria is alleviated, done away with. If we do not reseed the gut with the good, proper bacteria, then just like in your garden, when you take out all the weeds and you plant your pretty flowers, if you just leave it, guess what? The pretty flowers are probably going to fade away, but you're going to get a huge amount of weeds, right? Weeds just grow. Same thing in your gut. You take your antibiotics, everything goes to base level. You don't do probiotics because you don't know you're supposed to, or you do something that's not effective to bypass digestion and get into the small intestine and the large intestine where it needs to be, then what you've got in your gut is a high level of bad bacteria and yeast and pathogens, and a very low level of your good bacteria. So you're going to fall prey to infection after infection after infection because you don't have the good guys that are in there. So I hope that makes sense. Okay? Put something in the comments if that doesn't make sense. So what we are seeing, and this is just not what we are seeing here in the clinic, but what we are seeing worldwide, is that there is a influx of UTIs, urinary tract infections, that are antibiotic resistant. So we see here in the practice, we see women, mainly women with UTIs. All right. And so it's funny because when we're trying to work with people, I will ask them, when was the last time you had antibiotics? And they'll tell me, oh, not too long or not recently, last year. Well, that's pretty recent. All right. We'll ask somebody, I'll look in their eye, I'll see that there is a propensity for bladder, kidney issues. And so I'll ask them, well, when was the last time you had a UTI, or is that something that you deal with? Oh, not very often. I have about two or three a year. And it's like, that's a lot. I have not had a UTI in about 20 years. So this is not something that we should be expecting. If you're young, I'm going to say under 70, because just in our clinical practice, this is what we see. If you're young, you get a UTI, you go to the doctor, you get your antibiotics, you get over it, and you're good. If you're over 70, that's just not the case. For some reason, and I don't understand this, for some reason, older people do not have UTI symptoms. So a UTI symptom, for those of you who have been fortunate enough not to ever have them, is that you feel like your bladder is very full. You go to the potty, there's nothing there, maybe a teaspoonful, but you have all this pressure and the ureter spazzes, right? It cramps and you're feeling very irritated. So that is the number one sign in a younger person that there's something going on down there that you need to get taken care of. Older people, they don't have that. I don't know why. Men they don't know they have a UTI, and women don't know they have a UTI. And so these are some things that land people in the hospital. And what we're finding is that the particular UTI organisms are antibiotic resistant. So I'm giving you a little background to what we are going to be talking about. So infectious disease specialists, right, say that common urinary tract infections lead to emergency room visits and even hospitalization because of the failure of oral antibiotics. Now, why is that? Because I just told you we have antibiotics in our food, and so we are used to it. The bugs in our body have adapted to it, and so they're not effective anymore. So the article goes on to say that the germs that cause these infections have expanded their range during the year of 2020, and the Center for Disease Control and Prevention reports that we are finding more and more people that are going into the hospital with antibiotic resistant bacteria. So the FDA declined to approve 2 new promising drugs because it said that they did not treat the bacteria or handle the bacteria any better than what we had on the market. So the problem with the ones that we have on the market is the bugs have seen that before and they have mutated, so those antibiotics are not effective for them anymore. So that's the problem. In the meantime, the article says some UTI patients have to get admitted and have IV treatment for the bladder infection that typically would be treated with oral antibiotics. They give a case study of a lady who's an office worker in North Carolina. She was prescribed several courses of a cheap oral antibiotic for a persistent UTI earlier this year, but the UTI kept coming back. The doctor considered a 6-week treatment with IV drugs, but that would have cost her $2,000 out of pocket. Nobody can afford that. Nobody wants to afford that, okay? Specialists are saying they are seeing more and more UTIs that oral antibiotics cannot eliminate. And this is something that is really scaring them. A CDC report released in July the 12th of this year, 2022, shows that after mostly declining during the previous decade, the incidence rate of 7 deadly antimicrobial resistant organisms surged by an average of 15% in hospitals in 2020. Why is that? Because the doctors 80% of the time used antibiotics for, the pandemic, and the pandemic does not respond to antibiotics because the pandemic is a viral situation, right? So because the doctors used, and everybody was scrambling, and I'm not being mean, and I'm not, dogging the doctors for sure. That's what they did because they didn't know what to do. However, what happened was a lot of antibiotics, overuse of antibiotics, the bugs mutated so that the antibiotics are not successful. All right. Nearly 1.3 million people worldwide die of resistant bacterial infections each year. The FDA has not approved a new antibiotic since 2019. All right. Big Pharma has mostly abandoned antibiotic development. Why is that? Right? Because there's no money in it. So I hate that in here in the United States that we have a healthcare system that is driven by money. It should be driven by altruistic endeavors. Yes, it costs money to develop new drugs. I understand that. And yes, we need to have that money available. And I'm going to talk about something that's going on that, could be a good thing for that. However, the more an antibiotic is administered, the quicker the bacteria will mutate to get around it. Practitioners are aggressively curbing the use of these drugs, with 90% of U.S. hospitals setting up stewardship programs to limit the use of antibiotics, including the new one. That in turn has caused investors to lose interest in the antibiotic industry. Why is that? Because there's not that high of a return on investment. Now, I do understand that from a business point of view. I do understand that. However, as humans, right, we need to have substances that are going to help us. And so this is why I choose, and my family chooses, to do the natural stuff, because the natural stuff is something that is new. Each crop of plants, each crop of herbs is different. It's slightly different, and the bacteria has never seen that before. So it's really, I think, impossible, if you're using natural things, for you to have antibiotic resistant microbes in your body, which is what we do not want. We do not want that. It says some 90 to 95% of fatal infections involve microbes that are not drug resistant, but are rather difficult to treat for other reasons, such as the delicate condition of the patient. And we did see that the more cofactors you have, the sicker that you get. All right. So since clinicians can't quickly determine if a bug is antibacterial resistant, they tend to start with the old drug most of the time. Why is that? Because it is the cheapest drug. And so I understand that from a consumer point of view, we want to spend as less money as possible, right? However, this is why UTIs are on the rise, and this is why, if you're one of those people that has antibiotic resistant bacteria, then we've got some good news for you, because we can help. We can help with that. Antibiotics are an essential part of civilization, says Dr. He's not a doctor, Kevin Austerson, who is a Boston University professor who leads a public-private fund that helps companies develop antimicrobials. They must be renewed every generation, or we will slip back into the prebiotic area. Why is that? Because the bugs mutate. They have a survival system too. They want to last forever. And so they will find a way to escape the detrimental effects of the antibiotics. All right. The roadblock to approval of UTI drugs is because of complexity and regulatory challenges in the antibiotic arena. In the big clinical trial completed last year, the therapeutics were far better than older drugs, and they named Cipro, which everybody's familiar with Cipro, at reducing UTI symptoms, but it didn't seem as adept at killing the bacteria, which the FDA considered to be of equal importance. Now, that's important. Cipro is a fluoroquinolone class of drugs. If you look at those particular antibiotics, and I'm glad we have them, don't get me wrong, I'm glad we have them, but those are your last line of defense drugs, because they've got a black box warning that says use of these drugs can cause irreversible muscle damage. All right. What is the largest muscle well, maybe not the largest muscle, but the most important muscle in your body is your heart, right? So we don't want to overuse a drug that will cause irreparable muscle damage. I know that my bonus dad had some kind of surgery. They always give you antibiotics when you're in surgery, because they've opened you up and you've been exposed to pathogens. And within 6 months, he was out riding his bike, and he rides his bike 10 miles every day. He used to. I think he's slowed down a little bit now. He's a lot older now. And after he had that course of those antibiotics, he did just ride his bike and popped his hamstring. And so we see that a lot. So the fluoroquinolones are something that I personally don't want. I want to do a different type of drug first to see if it will help. Normally, I'm going to do my stuff. If it comes to a point where I can't do that, I'm definitely not going to do the fluoroquinolones, but Cipro is one of those. All right. So the FDA said, no, we're not going to approve this new drug, even though you're better with your symptoms, because that drug was not any more effective than what they had on the market. All right. The article goes on to say that although the oral drugs are not working, the patients can still have the IV antibiotics, which are better. Who wants to do that? Okay, that's so expensive. So, in a 2019 CDC report, found that there was an 18% reduction since 2013 in deaths caused by drug-resistant organisms and a 21% decline in infections with MSRA, which is antibiotic-resistant bacteria. Now, that all changed in 2020, as I said before, because of the overuse of antibiotics. The article goes on to say, there's so much in here, a report on 17 new antibiotics marketed in the United States over the past 5 years only saw 3 with sales over 100 million per year. The 17 antibiotics had average sales of 44 million for the 12 months ending in June 2020. So they're wanting to have more and more sales. There are 17 different antibiotics that were surveyed here. And so that's, not what they're looking for the investors, which is why we're having trouble getting new antibiotics. A second reason that we're having trouble is because Medicare reimbursement for treating hospital infections is low. There is no incentive for hospitals to invest in that type of capital to bring these new agents in other than just doing the right thing. In most cases, hospitals do appear to be doing the right thing. However, a recent CDC data showed 90% of U.S. hospitals had stopped using colistin, which is an old antibiotic, but it's very toxic. So they're trying to do the right thing. However, the newer drugs are more expensive, which hurts the consumer pocketbook. Just throwing that out there, especially if Medicare age, and Medicare does not want to fit the bill for that. There is a congressional bill filed in 2019 and resubmitted last year that would require Medicare to pay for the new antibiotics separately. Democrats blocked the bill, but the antibiotic producers argue that it would incentivize hospitals to use their drug. So this is where lobbyists come in, and I'm not really a fan of lobbyists, but the health of our nation is important, and we do need to have new antibiotics. We need to do this on a lot of different fronts. Number one, as consumers, we need to opt for organic meat. We need to opt for organic dairy. We need to opt for organic poultry. Is it a little bit more expensive? Yes, it is. Is your health worth it? Yes, it is. Okay. And so we want to do that. We also want to take good care of our body because we want to live in our body. We want to live in our body healthy all the time. Now, we've got some different things. If you have had antibiotics, almost everybody has had antibiotics at least once in their lifetime. If you don't know, I'm telling you, you need to reseed the probiotics. Antibiotics kill your probiotics. Chlorine in your water kills the probiotics. When you bathe in chlorinated water, you absorb that. That kills the antibiotics. So all of us, we're stressed, right? We have chlorine in the water. Thank God we do. Some countries don't. So we're fortunate that we know how to kill the microbes in the water. However, it kills the bugs in our system. So we want to make sure that we've got a really good probiotic. This is a really good one. It is in spore form, which means it goes through your digestion. Your hydrochloric acid does not eat it up because it's in a protective spore. It goes into your small intestine and into your large intestine so that it opens up and it repopulates the bugs that are in there. Once that happens, you want to do this. This is a postbiotic prebiotic that acts like Miracle-Gro in your belly. And so whatever you have reseeded, it causes it to grow and to bloom and to repopulate. You cannot have too many good bacteria in your system. All right. The more you have, the better it is for you. So you want to do that. If you are somebody listening to me and you have a chronic UTI, this is what we do, because do we treat disease? No, we do not. We help the body regain its immunity, to regain its warriors, right? So we're able to do that. Now, we use a lot of homeopathic medicine, and what we can do is we can tailor make a remedy for you that will tell your body, this is how you overcome this infection. We had a lady who was older, remember 70 and above, they don't always know that they've got a UTI. Well, this lady was close to that threshold. She had had a UTI for 35 years. And I asked her, I said, why have you had a UTI for 35 years? And she said, well, I had a procedure done, some kind of female procedure where they inserted a catheter. This is the number one way that you get bacteria up there is medical procedures, right? There are other ways too, but that's one that is. And so we did a special remedy for her. And as far as I know, I haven't talked to her in quite a few years, but when we did that, when I checked on her in 30 days, she was absolutely clear. Her blood work was good. Her urinalysis was good. And the bacteria was gone. So if this is something that affects you or affects someone that you know, then there is help for you with natural products that these bugs have never seen before. So they cannot adapt their way out of it. Okay. And so that's what we want. We want to keep our body clean. In your small intestine, you've got a different type of bug that works on your neurotransmitters. So if you are plagued with anxiety, if you're plagued with depression, if you're plagued with insomnia, all those kind of things, it could be because your belly bugs are wrong, right? And so it's a different kind of antibiotic that is in the small intestine than is in the large intestine. And when you take antibiotics, you clear all of that out. And so that might be why we're having the problems that we're having today, is because we are eating food that kills our immune system. I think it's about 75 to 80% of your immune system is in your small intestine. So if we wipe that out with antibiotics, not necessarily we go to the doctor and we get drugs, but we're eating and we're drinking food that's laced with antibiotics, then we have those kind of issues. So hopefully, there is this bill that is sponsored. It got knocked down, but it is still before the legislature. And it says that it would give $11 billion over 10 years for the development of new antibiotics. Because they're going to guarantee the drug companies, I think it's $3 billion for each drug. That encourages the drug companies to do what they need to do. And the drug companies are not dependent on prescription of these drugs, so that we develop more antibiotic resistant bacteria because of overuse of antibiotics. So I think this would be a really good bill if you're a grassroots politician person and you want to write to your representative in Washington, D.C. and say, look, I see that this is there. We want to do that. The bill is called the Louis Pasteur, right? The Pasteur Act. So you might want to call your representative and say, look, this looks like something that we might want to do, because we need to have some new antibiotics, and we really do. And I think that we do. Me and my family, we're going to do it naturally. But what happens if there's an accident and we have to go to the hospital and we're going to have antibiotics? We're going to need the ones that work, right? And so this affects all of us. And so I want us to be aware. And if you are someone that has a chronic UTI, there is help for you. So let me know what you think. Let me know if you have any questions, and we'll be happy to help you with that. Thank you for sharing. Thank you for commenting. And I will see you next week. It's the weekend. Have a great weekend. Do some relaxation, do some self-care, rest, recover, restore, and I will see you next week.